To begin, after sterilizing, assemble the stand. Attach one ring to the bottom of the upright. Attach the other ring to the top. Secure the stand to your table using the provided table clamps. After steam sterilization, remove the canister from the pouch. First, attach the fat evacuation tube to the stem on the bottom of the canister. Put it on with a slight twisting motion. If you dip the tube into sterile saline, it will slide on a little easier. Make sure the tubing is pushed all the way up against the bottom of the canister. Place the canister into the stand. Please note the stop indicator on the gradient. Though this is a 3-liter canister, you should never fill it past the stop mark. For proper function, you need to leave some capacity in the canister. Now, orient the pinch clamp properly and close it securely. Preload the canister with 800 cc's of sterile saline or lactated ringers. Do not use sterile water, as this will damage your fat cells. The fluid bath cushions the fat entering the chamber and gives it a nice wash. Attach the manifold. Place the open tube onto the port labeled EVAC. You will see it lines up with the evacuation tube that runs to the bilge. Secure the center cap. It is very important that the white pinch clamp always remain open during the harvesting process. Only close it to drain the fluid. Once you drain the fluid, immediately open the pinch clamp again. This is very important. Please take special note of this. Take the sterile transition tube that is provided and weave one end through the ladder rungs on the stand. This secures the tubing so it cannot be pulled off or fold over. Attach to the top connector on the manifold. Attach the opposite end to your waste canister. The waste canister connects to your aspirator. Never use a waste canister with an interior liner. Under certain conditions, the liner can collapse and cause a back surge. Connect your harvest tubing to the LIPO port. Connect the other end to your harvest cannula. The next step is very important. You're going to set your harvesting vacuum level. First, crimp your harvest tubing. This closes the system. With your vacuum level turned to the lowest setting, turn on your aspirator and bring the vacuum level up to 18 inches of mercury. This is the proper setting. You are now ready to harvest. As you begin harvesting, the fat falls gently into the fluid bath. The rinsing, separating process begins. Live cells will separate immediately to the top. Notice we are near capacity and we have a lot of fluid but not enough fat for our procedure. We will need to drain some fluid for more capacity. Always remove the cannula from the patient when draining the fluids. Make sure the LIPO tube is open and unobstructed. Next, close the white pinch clamp on the manifold. You will begin to see the fluid travel down through the separator, up the transition tubing into the waste canister. Since we are just trying to gain more room in the canister, you do not want to drain the fluid all the way down. Stop the fluid level at the 800 cc mark. Once you reach that level, reopen the pinch clamp and the flow will stop. You will notice that the fluid in the upper chamber will continue to flow down into the evacuated bilge. This is normal. At this point, you can continue harvesting in the same manner. Make sure the white pinch clamp is open before you continue harvesting. Additional rinsing of the tissue is not normally needed, but if you wish to do so, take the following steps. Remove the cannula from the patient. Close the white pinch clamp. Drain the fluid to the 800 cc mark. Reopen the pinch clamp to stop the flow. Pour saline into a sterile bowl and aspirate into the canister using your cannula. Now that you have given the tissue a final rinsing, allow it to separate undisturbed until clear separation is noted. This generally takes 8 to 10 minutes. For the final drainage, turn the vacuum down to about 8 inches. Close the pinch clamp and drain your fluid. When the fat reaches the funnel, open the white pinch clamp, turn off the aspirator. This is also a good time to remove the LIPO tubing. This is important so you do not have a vacuum block when you extract the fat. To extract the fat, connect the Toomey syringe to our new Jordy connector. This was designed to make the extraction process easier. Place the syringe tip into the fitting and give it a slight turn. Be careful, don't over tighten it. The Jordy has much greater gripping power than the old connector. To remove, pull and make a slight twist. Let's extract the fat. Attach the Toomey syringe. Open the red pinch clamp and draw out the residual fluid that remains in the stem and discard. Connect the Toomey syringe, open the pinch clamp, and draw out the fat. At this point, you can attach the new Jordy injection cannula. You can also use the Jordy transfer adapter to stage down to smaller lure syringes. The Jordy transfer adapter also doubles as a syringe cap by adding our non-vented lure cap.